Hello everyone and welcome to the channel. Today, we will dive into some recent research's results related to modafinil usage not only by healthy individuals, but also in treatment of diseases like schizophrenia, sclerosis, Parkinson's disease, and methamphetamine use disorder. Before we dive deeper into this topic, don't forget to subscribe to our channel for more research results related to productivity, health, and well-being. And also please keep in mind that the following video is strictly for informational, educational, and entertainment purposes. All shared experiences within this video are not to be mistaken for personal training or coaching. Please consult your physician in regards to your health. Presented experiences are not to be interpreted as any form of guarantee you will achieve the same gains or physique improvements. You could make more, less, or the same result if everything is 100%. They are not intended for the purpose of rendering medical advice. The contents of the Epic Health Flow YouTube channel are not intended as a substitute for professional medical advice, diagnosis, or treatment. Also, content that promotes or features the following is not suitable for advertising: sale of illegal drugs, regulated drugs, or substances, or other dangerous products, use of illegal drugs, regulated drugs, or substances, or other dangerous products, abuse of illegal drugs, regulated drugs, or substances, or other dangerous products. Videos discussing drugs or dangerous substances for educational, documentary, and artistic purposes, such as music videos, are generally suitable for advertising, so long as drug use or substance abuse is not graphic or glorified. Now, let's begin. Let's start with study number 1, which is about modafinil in schizophrenia treatment and was published in Psychological Medicine in 2022. A recent systematic review and meta-analysis published in Psychological Medicine in 2022 examined the use of modafinil as an additional treatment for negative symptoms and cognitive deficits in people with schizophrenia or schizoaffective disorder. The review included 13 randomized controlled trials with a total of 618 participants. The key findings of the meta-analysis were that modafinil, when used alongside antipsychotic medication, resulted in a small but significant improvement in negative symptoms compared to placebo. Negative symptoms refer to the absence or reduction of normal behaviors and feelings, such as social withdrawal and lack of motivation. Modafinil led to a standardized mean difference of -0.27 in negative symptoms, which is a statistically significant improvement. Additionally, there was a small but significant benefit seen in overall cognitive functioning, with a standardized mean difference of 0.28. Specific cognitive domains that showed improvement with modafinil included attention, working memory, and executive functioning. Modafinil was also well tolerated by the participants, with no significant differences in adverse events compared to the placebo group. This suggests that modafinil is a safe and potentially effective adjunctive treatment option. However, it's important to note that the quality of evidence was rated as moderate due to certain limitations in the included studies, such as small sample sizes and short treatment durations. As a result, while this meta-analysis provides encouraging evidence for the benefits of modafinil as an adjunctive treatment, larger and longer-term trials are still needed to confirm these findings definitively. Now let's look into study number 2, which touches multiple sclerosis treatment with modafinil. The article, Modafinil for Fatigue in Multiple Sclerosis, published in the Journal of Neurology, presents a systematic review and meta-analysis on the use of modafinil for treating fatigue in multiple sclerosis patients. The review included data from 8 randomized controlled trials with a total of 567 participants. The analysis showed promising results, with modafinil leading to significant improvements in fatigue scores compared to placebo. Specifically, a dosage of 200 mg/day was found to be the most effective in reducing fatigue, even more so than higher doses. Additionally, Modafinil also improved excessive daytime sleepiness and depression scores in this patient population. In terms of safety, the most commonly reported adverse events were headache, nausea, anxiety, and insomnia, but the overall risk was not significantly higher than placebo. The quality of evidence was rated as moderate, and larger long-term trials are needed to further strengthen the understanding of modafinil's efficacy and safety in treating multiple sclerosis-related fatigue. Nonetheless, the current findings suggest that modafinil is an effective and relatively safe option for managing fatigue and improving the quality of life in multiple sclerosis patients. Now, we quickly jump into study number 3 discussing modafinil usage for Parkinson's disease. Modafinil has shown promising results in alleviating fatigue and excessive daytime sleepiness among Parkinson's disease patients, according to a recent systematic review and meta-analysis published in the Journal of Neurology. The analysis, which included data from 7 randomized controlled trials involving 476 participants, revealed that modafinil significantly improved fatigue scores and reduced excessive daytime sleepiness compared to placebo. The effective doses ranged from 100 to 400 milligrams per day across the studies. While common adverse events such as headache, nausea, anxiety, and insomnia were reported, the overall risk was not significantly higher than placebo, suggesting a relatively good safety and tolerability profile for modafinil in this patient population. The quality of evidence was rated as moderate due to small sample sizes and variations in outcome measures used across the included studies. However, the findings provide support for the use of modafinil in managing fatigue and excessive daytime sleepiness in Parkinson's disease patients. Next stop, the study number 4, which discusses how modafinil can help people with post-stroke fatigue. Modafinil has shown promise in alleviating post-stroke fatigue, a common and debilitating symptom experienced by stroke survivors. A recent systematic review and meta-analysis published in the European Journal of Neurology examined the efficacy and safety of modafinil for this purpose. The analysis included 5 randomized controlled trials involving 290 stroke patients. Pooled data revealed that modafinil significantly improved fatigue scores compared to placebo. Effective doses ranged from 100 to 400 milligrams per day across the included studies. Beyond fatigue reduction, modafinil also demonstrated benefits in improving excessive daytime sleepiness, depression, and health-related quality of life measures in stroke patients. Common adverse events like headache, nausea, anxiety, and insomnia were reported, but the overall risk was not significantly higher than placebo. While the quality of evidence was rated as moderate due to small sample sizes and variations in fatigue assessment scales, the meta-analysis found no evidence of publication bias. The authors concluded that modafinil shows moderate quality evidence for reducing post-stroke fatigue, with additional benefits for sleepiness, depression, and quality of life. However, larger long-term trials are still needed to confirm these findings and establish optimal dosing regimens for modafinil in the management of post-stroke fatigue. And now we land at study number 5, which explains how modafinil could help if you have methamphetamine use disorder. A recent study investigated the effects of modafinil, a wakefulness-promoting drug, on cognitive function in individuals with methamphetamine use disorder. It was a randomized, double-blind, placebo-controlled trial involving 60 adults who received either modafinil 200 milligrams or placebo once daily for 8 weeks, along with cognitive behavioral therapy. The researchers assessed cognitive function using the MATRICS Consensus Cognitive Battery at baseline and after 8 weeks. The results showed that modafinil significantly improved overall cognitive performance compared to placebo, with a moderate effect size. Specific cognitive domains that showed improvement included attention/vigilance, working memory, visual learning, and reasoning/problem solving. Importantly, modafinil was well tolerated, with no significant differences in adverse events compared to placebo. However, the study had some limitations, such as a relatively small sample size and a short treatment duration of 8 weeks. In summary, this randomized trial found that modafinil 200 mg daily for 8 weeks, when combined with cognitive behavioral therapy, led to moderate improvements in overall cognitive function, as well as specific cognitive domains in individuals with methamphetamine use disorder. Larger and longer trials are still needed to confirm these findings. And now, we are starting to look into some insights related to modafinil usage by healthy people. First, we look into the study number 6. The article, Modafinil for Cognitive Enhancement in Healthy Non-Sleep-Deprived Individuals, a randomized controlled trial, published in the Journal of Psychopharmacology, investigated the effects of modafinil on cognitive performance. The study included 64 healthy adults who were given either modafinil or a placebo. The results showed that modafinil did not significantly improve overall cognitive performance. However, it did show benefits in specific areas, such as visual memory and spatial planning ability. There were no significant differences found between the modafinil and placebo groups in other cognitive areas like attention and working memory. And lastly, we have study number 7, published in 2023, entitled Do Medical University Students Use Cognitive Enhancers While Learning? Conclusions from the study in Poland. Researchers investigated the use of cognitive enhancers among medical and dentistry students in Poland. The study surveyed 385 students between July 2021 and January 2022. The findings revealed that 14.8% of the students admitted to using cognitive enhancers such as modafinil, methylphenidate, and amphetamines to improve concentration, alertness, and academic performance while studying. Modafinil was the most commonly used cognitive enhancer, particularly among male students who took it for increased concentration and alertness. Female students more commonly used vitamin B12 supplements for improved academic performance and concentration. The use of cognitive enhancers increased with each year of study, peaking in the 4th year for most programs. Students often obtained information about cognitive enhancers and purchased them online. The study highlights a notable prevalence of cognitive enhancer use, particularly modafinil, among Polish medical and dentistry students to boost academic performance, with usage increasing in the later years of study. And that's all for today's video. As always, links to research papers are in the description below. Watch another interesting video we have prepared for you. The link should be visible on the screen. And for more healthy insights like this one, subscribe to our channel. Stay tuned, stay healthy.